Hello, everyone. I am James Dillard, and I am excited to introduce for the first time ever, live to tape, Second Opinion with Dr. Dua Hassan. Dua is a doctor at Boston Children's Hospital and a former clinical instructor at Stanford University. She has her MD and MBA from Columbia University, and she's here to talk with us about all of the things that you are concerned about when you have kids and you're interacting with the medical establishment. Dr. Dua, thank you so much for being here today.
Thank you, James. And I am really excited to do this with you and launch this podcast. For the first episode, I thought that we would just dive in and discuss hepatitis B. Part of the reason why I thought this would be interesting is because, as we all know, Donald Trump recently had his press conference focused on curing autism and spent the time, half the time talking about Tylenol. But the other half of the time, he actually spent it, some may say attacking, others may say criticizing the vaccine schedule. And so I wanted to focus on his thoughts about the hepatitis B vaccine. I think just to very notably say, he said Hep B is a sexually transmitted disease, which it can be in adults, but we're talking about babies and children. And so for newborns, the primary concern isn't sex, but it's transmission from mom to baby. So whenever mom transmits something to a baby, we call it perinatal transmission. And this is a very basic pediatric fact. That's what you are vaccinating the babies for.
Can I ask a dumb question? What are the hepatitis and how are they different?
That is a great question. All of the hepatitis cause inflammation of the liver, and the different hepatitis kind of have a different illness trajectory and slightly different viruses that cause them. But the hepatitis B virus in particular is important because it can cause a serious viral infection that attacks the liver. And for kids and for infants and for babies, especially, if they get this virus at birth, then they have something like a 90% chance of developing chronic hepatitis infection, and that causes chronic liver disease, which causes cirrhosis and eventually cancer or death. And so that's why we are so worried about hepatitis B in particular and why we give it to infants.
And so this is one of the shots. So I have, my reason to be here is that I have 3 kids and that I'm the stand-in for the typical parent. This is one of the battery of shots that you have in it, right after the baby is born in the first week. When does this one come?
Yeah, that is a great question. And with your 3 kids, I'm sure you remember that, or probably not, because you have more important things happening after. Livy, your wife, had more important things happening after the baby comes. But it's the reason why it's so controversial. It's because it's the one you give, I don't know if you remember, with your kids on the first day of life. So they take your beautiful baby from you, and it's one of the things that we poke the baby with. And I think that's one of the reasons why Trump and RFK Jr. are so focused on it. The interesting thing is that Trump, after saying it was sexually transmitted, which is not true for infants again, he said he recommends giving it at 12 years, which I'd like to ask the question, why 12? Why not 13? Why not 14? Why not 11? It's just kind of like a number he came up with on the spot. And that's not how vaccine schedules should work. Having said that, the reason why I thought this was an interesting conversation is, even though that particular argument maybe doesn't have any evidence behind it, I do think there is an important underlying question, which is, what is the optimal time to get the hepatitis B vaccine? As I said earlier, it's crucial to vaccinate your children against hepatitis B for all of those reasons, but when should you give that first shot? And James, I think you're the perfect person to talk with about this because you saw 3 kids, your 3 babies, get that vaccine. I don't know, how did that feel for you and your wife?
I didn't have a strong look. You don't like watching your baby cry. At the same time, there's a lot of crying. For me, the shots were not particularly traumatic. With that said, I am not sure that I could explain to you why certain shots were given on which day or which order. And I absolutely think it's the sort of thing that a parent, I feel like I probably should understand than I actually do. Instead, smart people have thought about this. I also understand that for a lot of people out there, they're you don't necessarily trust the process of getting to those things or don't understand it or have criticisms of it. And so that's just not a place where I certainly have my set of those things. It's just vaccines haven't.
Yeah, that's fair. And I think a lot of people, they don't know what to expect after the baby's born. So right after the baby's born, there's a cocktail of 3 things that we offer. First is the vitamin K shot. The second
That's the one
is
I remember. I remember vitamin K. Yeah. Okay.
And the second is the erythromycin ointment. And the third is the hepatitis B vaccine. And I used to attend on the newborn nursery. And so it was often the case that mom and dad just delivered their baby, probably their first baby, and she's really tired and holding the baby. And then she's being asked to hand the baby over to get this cocktail of 3 medicines. And I had many instances actually where families refuse. And this is sometimes you can't practice perfect medicine. You have to practice, I think, imperfect medicine, real medicine, be practical and pragmatic. And I will often sacrifice the hepatitis B vaccine in order to make sure that the baby gets vaccinated, gets the vitamin K shot. You know, part of the reason for that is vitamin K protects against potentially devastating bleeding. And so that's why it's very urgent to give to babies right away, helps prevent that type of bleeding. And so I'll often negotiate with the parents, and I have found that to be really effective. I'm just an N of 1, but I would say like actually every single patient who declined the vitamin K vaccine, except for one person, ended up taking the shot after I sat down and talked with them and emphasized vitamin K and said, we can wait on Hep B and tried to negotiate, if that makes sense.
And so what goes into waiting versus like why? So you mentioned the risk that comes with vitamin K. Why is it acceptable to wait with hepatitis B? And if you can wait for a couple of days, like why not wait for a couple of years or even 12 years? And I guess I'm also really curious about what the steelman argument is for presumably people that are saying wait until 12 years didn't wake up one day and say, let's wait until age 12. Something led them down the path. What are they seeing that leads them to think this is risky? What's the trade-off here?
First, the people who say age 12 literally just made it up on the spot. It was literally something that they just randomly made up. I don't know of any country that waits until 12 years to vaccinate. But again, not every country vaccinates on day of life 1. So just to start from the very kind of big picture, why do I sometimes as an aside, I have 2 kids, and I like to tell my patients that anything I recommend to them, I did with my own kids. So for my first kid, my son, I vaccinated him on day of life of 1 for hepatitis B. And then for my daughter, I actually did not give her that first shot because I sometimes will negotiate with parents. And that's to say that I think both are good options. So the first thing I want to say is the reason why I think, the way I think about this is, I think the first question we should ask ourselves is, what is the risk of this baby having hepatitis B on day of 1? And why do we give it on day of life 1 in the first place? And as I said earlier, the main concern is this perinatal transmission, transmitting the virus from mom to baby. But this is a really important fact about women in the US. We screen every mom in the US for hepatitis B while she's pregnant. And our modern prenatal screening is actually really accurate. It's something like 98% sensitivity and specificity. Sensitivity means like, how sensitive is this test picking up whatever it is that we're trying to detect? And specificity means how specific is it for this illness. So it's actually a really good test that we use to screen moms. And so for most moms, again, basically every mom who gets prenatal care in the US, if she's negative, her risk of transmitting the virus to the baby is near 0. And when I practice clinically, if mom was screened negative for hepatitis B and she hasn't engaged in any new sort of risky behavior in the last month or so of her pregnancy, I think it's reasonable to wait until 2 months to give that first shot. And I think, obviously, the question, so, there's 2 options here. We screen moms, they're negative, and we give them the baby's hepatitis B virus on day of life 1, or should we wait until 2 months? And I think, we need a real-life case study of this. And one really great case study is actually the UK, where one of our producers, Ori, is partially from. And in the UK, which is a very comparable country to our country, it's a high-income country with really good healthcare, some might say better, and a similar hepatitis B prevalence, they don't actually give the hepatitis B vaccine to babies on day of life 1. They screen moms just like we do, and if mom is negative and there's no known household contact that's infected and no increased risk factors, they actually just wait and give it at 2 months. And they, similar to us, have essentially eliminated mother-to-child transmission. So their rates of infantile hepatitis B transmission is comparable to ours. And so that's one of the other reasons why I think it's, on an individual level, it can be a valid strategy to wait until the 2-month vaccination series.
And then why doesn't, like, if RFK Jr. were to join us over an invitation, Mr. Secretary, what would be his argument for not doing it in the first year? Or why is this an issue versus any other thing that could be today?
That is a great question. And I think we are going to find out, unfortunately, a lot more in the next few months. I would say that you should absolutely vaccinate your child against hepatitis B. I think that hepatitis B, as I said, would have a devastating effect on your child if they were to get it. And as your child gets older, they're going to be exposed to more and more people. So hepatitis B in the infantile stage is mostly transmitted from mom to baby. And in adults, it can be transmitted sexually. But for children, it's actually transmitted through vertical contact. So maybe another toddler at the daycare has hepatitis B. Maybe your
mix of germs, the germ
exactly
pool that is the daycare. Yeah.
Exactly. And so, once your kid is, that's why I wouldn't recommend waiting longer than 2 months, but I think it's reasonable to wait until 2 months, if that makes sense.
So that's important. So hepatitis B is sometimes sexually transmitted in adults, but is transmitted like colds or stomach bugs in younger children or babies. And then for really young babies, it's mom. And so there's different risk factors for different ages.
Exactly. And just to clarify, unlike the cold, which obviously can be transmitted in the air, it's through bodily fluids.
Yeah, I guess I was thinking more about hand, foot, and mouth. Is that the one that is if you wash hands, it's effective, whereas the sneezing, if the cold is in the daycare, everyone's getting the cold, but hand, foot, and mouth, if you're clean, you might have a shot at missing it.
Exactly.
Is there any risk to the hepatitis B vaccine? What are the downsides? Look, the place with the vaccines in general, different parents, obviously, if I've learned anything as a parent, is there are many different ways to parent children. But I personally am not particularly worried about pinprick. I don't remember any of the shots that I got as a kid. Actually, some of my favorite moments with doctors were shots, because a really great doctor, a 6 or 7 year old, he would always, he'd have me say Barry Bonds. Barry Bonds is a Pittsburgh Pirates baseball. He'd have me say Barry Bonds, Barry Bonds, Barry Bonds, and then he would stab me, and it would be over, right? And it's a fond memory. I remember bonding with him over that. So I'm not worried about the pinprick. I am sometimes worried about what are the secondary consequences of this? Does somebody understand secondary consequences of this? Yeah.
Yeah. I mean, I will say the hepatitis B vaccine is one of the most studied and longest vaccines that we've been giving. And with any vaccine, there's a very, very, very small chance of something called anaphylaxis, a really bad, severe allergic reaction. But beyond that, there really aren't any known, well-studied, well-discovered side effects from the hepatitis B vaccine. So it's a vaccine we've been given for a long time. It's very well studied in a global context. The WHO even recommends it globally. I will say, having said all of that, how do we study the effects of the vaccine, right? If you think about the RFK Jr., not just him, but that entire network, their claims are you get the hepatitis B vaccine on day of life 1, and then maybe you get an autism diagnosis at 2 or 3 years, and then they are essentially ascribing causality to that hepatitis B vaccine. But as you can imagine, over the course of 2 or 3 years, there's that many different exposures, many different things. And so I will say that the hepatitis B vaccine is well studied. There are no side effects. I think the science is very clear. The benefits of the vaccine clearly outweigh any potential harm. But with the caveat that it's really tough to have these really longitudinal outcome studies in pediatrics in particular. And I think that's something that some vaccine skeptics will exploit.
And so when we say that there are no side effects, what does that actually mean? Does that mean that no one vomited, no one died from vaccine, as far as I understand what all those words mean, but then I'm okay, how does one get to the point where we say that? What's underneath that?
Yeah, that's a great question. When we say that there are no adverse effects, it doesn't mean that people don't get nervous before the shot. It doesn't mean that your kid won't have maybe a slight fever after the shot or have a sore arm. So those sorts of relatively mild side effects are common. And I've vaccinated kids and they've maybe had a low-grade fever afterwards or a sore arm. I'm sure we all have had that even as adults. So that's not what we're talking about. When we're talking about reactions to vaccines, we're talking about serious side effects. And in the sort of RFK Maha, I think, wing. I don't want to ascribe it just to him, but I think the ether that's around him. The question of vaccines and autism in particular, and that link has been thoroughly investigated, and there doesn't seem to be any signs of causality.
And so what has them attached to this idea? And I understand that from your perspective, there may not be a whole lot to it, but what's the story that they're telling themselves? Because they're certainly not waking up every day. Look, there's a million things that they could wake up and decide to care about, and they're deciding to care about this one. What's the like narrative that's getting them to that point?
As a physician, it's really tough for me to honestly understand their logic. But, if you had asked me this question before I had kids, I would have said, I don't know. But now as a mother, I feel actually somewhat sympathetic to their point of view because it's just really tough to bring your baby in at 2 months and then they get like 3 different shots and then they start crying and your baby was just finally starting to sleep at night and getting into a routine. And now at 2 months, they get these shots and they're like fussy all night. They have a low grade temperature. Like I actually can understand and have some sympathy because I think that like sometimes as a parent can be a little bit traumatic to watch your child get vaccinated. In the short term, it's very uncomfortable for the infant, even though in the long term, rationally gives them a lot of benefits. And so what I think is happening, and one of the reasons why I wanted to discuss this topic is I think that people just have a strong emotional reaction to their child getting a vaccine because it's painful, because the baby's screaming, because it disrupts them as they're just starting to get used to life and existence. And so I think that's why I think where there's areas of flexibility as physicians and especially as pediatricians, we should be willing to be like, you know what, it's okay. You don't have to give the hepatitis B vaccine today. You can get it at 2 months. That's totally fine. Like your baby was just born. You want to hold them. You want to bond with them. That's totally fine. And so that's actually what I think is happening. I think it's a very strong emotional reaction.
All right. Maybe that's a place to leave it. We'll pick up with more stuff next time. Dr. Dua, thank you so much for walking us through this. I know it's a tricky topic, and I'm sure people will let us know what they think. We're early in this journey together, but let's try to make sure that even when we disagree, we're respectful and kind to each other because we're all just trying to make it through the day. That's all we got, and talk to you next time.
Great. It was great, James. Thank you.